Assalamu alaikum. I'm Dr. Rowshon Ara Begum, Assistant Professor, Department of Forensic Medicine. Today, our topic of discussion is abortion, the consequence of delivery as well as pregnancy. So, as an introductory phase of abortion, about 10% of pregnancies are end in spontaneous abortions, much more than the accounts of induced abortion under Medical Termination of Pregnancy Act of 1971. Any induced abortion beyond the scope of Medical Termination of Pregnancy Act is criminal abortion. So, as a definition of abortion, medically it is defined as premature expulsion of the fetus from the mother's womb at any time of pregnancy before full term of pregnancy is completed. Medically, abortion is defined as expulsion of the product of conception from the gravid uterus at any period of gestation before the full term. In the light of obstetric conception, abortion includes if within the first 3 months, that is 12 weeks, it is abortion term. If it is between the 4 to 7 months, that is 16 to 27 weeks, it is called miscarriage. And if the delivery occurs after 7 months until the full term of the delivery, it is called premature delivery. But legally, all above the terms are synonymous, and the miscarriage term is synonymous with the spontaneous abortion. So, abortion is classified in mainly two basic types, that is the natural abortion and artificial or induced abortion. Again, natural abortion is classified as a spontaneous abortion and accidental abortion, as well as the induced abortion is classified as justifiable abortion and criminal abortion. This justifiable abortion is done therapeutically, so termed as therapeutic abortion. Again, the natural abortion, the spontaneous abortion or miscarriage is again classified on the basis of isolation or recurrent, are threatened abortion, inevitable abortion, complete abortion, incomplete abortion, missed and septic abortion. So, this accidental spontaneous abortion can be traumatic origin as from fall from height or from a heavy journey of the pregnant gravid female, as well as missed abortion or habitual abortion. In case of induced abortion, it is either legal, that is justifiable abortion, or illegal, that is criminal abortion. Now, spontaneous abortion. Around 10 to 15 cases of pregnancies, mostly in 2nd to 3rd month of the gestation, occurs this spontaneous abortion. The causes mainly defect in the ova, that is including the chromosomal defect leading to hereditary mole, developmental defect of the fetus, low implantation of the zygote, RH incompatibility, uterus problems like as retroverted uterus or submucous uterine fibroid, also disease of the decidua or placenta. Also the malformation of the uterus or uterine hypoplasia, even mother complications such as high fever of mother, hypertension of the mother or diabetes mellitus, maybe also gestational diabetes, deficiency of progesterone hormone, some disease conditions like nephritis, syphilis, also sudden shock and emotional disturbance of the mother, and also linking by the poisoning cases such as metallic poison, arsenic poisoning or lead poisoning, also some vegetable poisoning that owes to the toxicity. This classification cause may be as origin, paternal classification, maternal classification or the fetal classification. From the paternal side, the causes may be disease like syphilis, tuberculosis or old age, that is general debility. In case of maternal cause, basically the uterine causes like cervical incompetence or other pathological condition of the uterus as malformation or retroverted uterus or so and so. Constitutional causes like as syphilis, acute fever, diarrhea, diabetes, jaundice, hypertension, anemia. Placental causes like acute hereditary mole, degeneration of the placenta, placenta previa or other diseases involving the decidua or placenta. Some near nervous or mental conditions such as shock, sudden frightening, sudden joy or sorrow, that means the emotional imbalance of the mother, violence or trauma resulting from the fall from height, blow or kick on the abdomen, and also some acute or chronic poisoning cases as the metallic poison. In case of fetal cause, it is the inflammation or fatty degeneration of the placenta, also faulty development of the fetus and disease of the fetus like as syphilis. The factors terminating to this spontaneous abortion is genetic 2 to 5%, Anatomical abnormalities like as 10 to 15% involving the uterine malformation or others, autoimmune or other clotting disorders involving 15 to 20%, infectious causes like nephritis, syphilis are 0.5 to 5%. Some endocrine or hormonal cause like as progesterone deficiency is 15 to 20% and other unexplained, that is 40 to 50%. Now, therapeutic abortion. Abortion is justifiable only when it is done in good faith to save the life of the woman and if the materially endangering the continuation of the pregnancy. The World Medical Association adopted a resolution on therapeutic abortion that is known as Declaration of Oslo. It is known in 1970. In case of legal or justifiable abortion, the medical termination of pregnancy is guided by MTP Act 34, that is Medical Termination of Pregnancy Act in 1971, which comes in force in 1st April 1972, imposing the restrictions of the termination of pregnancy. Now, the grounds where the justifiable abortion is indicated. There are mainly 4 grounds where the justifiable abortion is indicated, that is therapeutic ground, eugenic ground, humanitarian ground and social ground. Only under these 4 circumstances, inducing abortion, that is termination of pregnancy by a medical practitioner, is justified, and out of these 4 causes, it will be caused criminal termination of pregnancy, that is criminal abortion. In case of the qualification and experience of the doctor, the medical man must have post-graduation degree like DGO, FCPS or MS, or a registered medical practitioner who has assisted at least 25 cases in a recognized medical center is eligible for MTP. The center to perform this MTP or medical termination of pregnancy is well equipped with modern facilities for surgery and anesthesia. Also, the center should have license from the government. All indications, that is the 4 indications of MTP, are applicable up to 20 weeks of pregnancy, and after 20 weeks it will be not permitted. Only one doctor can perform medical termination of pregnancy up to 12 weeks, and from 12 to 20 weeks 2 doctors must be engaged. Above 20 weeks MTP is carried out only when there is risk in mother's life and can be performed by junior doctor even in an unrecognized medical practitioner when to save the life of the mother. In case of abortion, the consent is very much vital point, and the consent from the female above 18 years of age with sound mind can give this consent. Consent of the woman is not necessary if she is minor, that is less than 18 years, or a mental condition is detected, that is lunatics. Consent from the guardian is needed in this situation, and the consent of the married husband is not necessary at all. Now, the therapeutic grounds where the medical termination of pregnancy is indicated as the continuation of pregnancy endangers the life of the woman and cause serious bodily injury, even physical or mental health, like as the heart disease, that is organic origin with heart failure, acute or active tuberculosis, severe diabetes mellitus, hypertension complicated by cardiac or renal failure, nephrotic syndrome, pulmonary hypertension, hepatocellular failure, acute hepatitis or pancreatitis, toxemia of pregnancy, uterine hemorrhoid or infected uterus, malignant neoplasm of breast or any female genital tract, repeated caesarean section or irreducible prolapse of the gravid uterus, threatened insanity, hereditary form mole or acute hydroneus. Now, the second cause is eugenic ground. When there is risk of the child that being born with serious physical or mental abnormality is a ground as eugenic, like as the German measles, the chicken pox or smallpox, viral hepatitis or other serious viral infections that is contracted with the first trimester of pregnancy. Also, exposure to X-ray and other radiations, that is over 200 radians. When the pregnant mother has received some cytotoxic drug or LSD or thalidomide, when parents have inheritable mental or chromosomal abnormality, all these are eugenic ground. Humanitarian ground is when the pregnancy is resulted as sexual assault, basically rape, and social ground, that is pregnancy arising out of failure or contraceptive in case of married women. The methods for performing this abortion are basically drug induced, that is abortifacient drug, use of general violence and use of local violence. The abortifacient drug is preferred for first 2 months of pregnancy. General violence is up to the end of first month and local is during the 3rd and 4th month of pregnancy. The drugs, that is abortifacient drugs like as ecbolics, that is ergot, causing uterine contraction. Any others are drug acting to the genitourinary system or drug acting to the genitointestinal system. Inorganic, some irritants also used such as abortifacient stick and also the vegetable irritations. Some other facts that we do for justifiable abortions as dilation and curettage, electrical vacuum aspiration, low rupture of the membrane, using of oxytocin infusion with dilatation, use of the Uthas paste made by the metallic content, amniotic fluid replacement by hypertonic glucose or saline solution, abdominal hysterectomy and also some prostaglandin preparations. That's all for today. Thank you. Assalamu alaikum.